And our next speaker is Josephine Canella Krehl. And Josephine is a graduate of SUNY Stony Brook in New York. She had a focus in psychology in 1988, and then she went to Florida State University for a Master of Social Work degree, which she received in 1990. Josephine began her career as a substance abuse therapist. She obtained licensure as a clinical social worker in 1994, and since then she's worked with a variety of populations, most notably in the hospice field with terminally ill patients. When her father was diagnosed with terminal lung cancer, she began researching cannabis as a therapeutic agent, as she began to realize that not only patients but their family members were having to become criminals in order to access a plant that was providing them relief at their most vulnerable time. She felt a real call to action. She's been busy up in the Capitol connecting with the Florida Cannabis Action Network, and began developing strategies for the creation of sensible cannabis policies. She's testified Florida Department of Health Rules and Regulations Committee, as well as both the Senate and House committee meetings. So she's been busy on the lobbying end. And now that Florida has an active medical cannabis program, Josephine educates professionals and the general public on how Florida's program works. She helps connect potential patients with approved cannabis providers and continues to advocate for the dignity, honor, and informed decision-making of patients. Let me tell you, she got a lot of ground to cover in the next couple of minutes, so you need to lean in and listen fast, because that's the way she's going to be moving. At any rate, here to share her experience helping people understand what medical cannabis is doing to make people well again, please join me in welcoming Ms. Josephine Canella Krehl.
Hi everyone. I'm going to try to turn my timer on to keep myself on track. So thank you for choosing to join us for what I consider to be a most important conversation. Today, I'll introduce you to the human endocannabinoid system, what it is and what it does. I'll show you how our bodies are actually made to receive the benefits of the cannabis plant, and I'll review the conditions that qualify. The goal is to empower you with knowledge so you can come away with a better understanding of how cannabis can work therapeutically. I decided to open today by sharing a small glimpse of what this journey has looked like for me. So I created a video clip of some of the people I've met along the way. Ladies and gentlemen, these are just a small sampling of the faces and families that fought so hard to bring medical cannabis to the state of Florida.
I might add that Leonard is our very able technological assistant.
Would you go to find the treatment for your child? Would you go to another town, another state, another country? Would you only do what your insurance will pay for? Or would you be willing to go outside the box and spend thousands of dollars out of your own pocket? Would you change doctors? And if so, how many times? Because it's not easy. Would you be willing to break the law? 11 years ago, I would have answered these questions very differently than I do today.
Dahlia, Joan, my beautiful friend Linda and her dad, Kathy Jordan. This was submitted by a veteran with post-traumatic stress disorder. Me and my dad. My beautiful friend Amy and her little boy that she lost to brain cancer. Vera. John wanted me to show you all of his prescriptions. Alex. Elvie. Duchess.
Politicians have become pseudo-physicians and medical experts, deciding with the stroke of a pen which illness gets treated and which one doesn't. Determining which illness is worthy, and who goes to treatment and who goes to jail based on the state you live in.
So we took it to the state. We took it to the federal government, and we took it to the United Nations General Assembly Special Session on Drugs, advocating for safe and legal access to cannabis for those who want it. And this clip is dedicated to my friend Drew Christian Wright, who died while we were waiting for Governor Rick Scott to sign terminal access into law. So I've met some pretty incredible people along the way. People.
Would you go to another town, another state? Would you only do what your insurance will pay for?
And now do I go with this one? Okay. So for me to have the opportunity to share with you about something I'm so passionate is really exciting. So welcome to my presentation, Cannabis Therapeutics, Clearing the Air. I'd like to begin by saying that I believe cannabis should be offered as a first course option and not just as a last resort. And personally, I don't believe anybody should be made a criminal for using a plant that has been shown to be so safe and effective when mindfully administered. So I'm curious, who in here has ever heard of the human endocannabinoid system? Okay, so that's really an improvement over when I first started talking about this several years ago. I used to ask that question and I usually didn't get any hands up. Cannabis is making its way back into the mainstream. Even Walgreens put out an article on Tumblr a few years back entitled Clarifying Clinical Cannabis, stating some of the indications for use as being cancer pain, Parkinson's, Tourette's, Alzheimer's, cardiovascular disorders, glaucoma, and palliative care. Common side effects reported by patients using cannabis-based medicines include dizziness, sedation, which can be a welcome side effect, especially for those who struggle with getting a restful night's sleep, short-term memory loss, dry mouth, and euphoria. Now, Merriam-Webster defines euphoria as a state of well-being or elation. I would imagine if we could present chronically, critically ill people with an alternative where one of the side effects is a state of well-being, that would be a welcomed alternative. Now, while it's true that cannabis has never led to a death due to overdose, I do want to add a few words of caution because some of the products that we have in Florida are high THC concentrated oils, and they are much more powerful than the ground up plant. So that's why it's really important to start low and go slow, as we say. Cannabis can also interact with certain medications, and that's why it's really important to provide a list of medications that you're already taking and review those with a physician before you start using cannabis, including CBD. Tolerance to the side effects generally develops within a short time, and people using cannabis-based medicines report that the side effects are often much more easy to deal with than many of the prescription drugs that their doctors have already recommended for them. So I've been fortunate to learn from some of this country's, really this world's leading experts on cannabis therapeutics. Dr. Dustin Sulak is an integrative healthcare practitioner out of Maine, and his clinics have treated nearly 20,000 patients with medical cannabis. He talks about how this plant can have so many healing properties without many of the side effects that are common with prescription drugs. He tells us that as far back as the late 1980s, scientists discovered that we all have an endocannabinoid system. It's a human regulatory system, and it helps to keep us in balance at the cellular level. We all have CB1 and CB2 receptors. CB1, denoted in the light blue, are found mostly in the brain and the central nervous system. The CB2 receptors, in the dark blue, are found mostly in the peripheral organs and in the immune system. THC, CBD, CBN, the other cannabinoids in the plant work like keys that act on the locks, the CB1 and CB2 receptor sites, helping to bring the body back into balance, explaining why cannabis can be helpful for so many different diseases and disorders. Now, not only do we have cannabinoid receptors, our bodies are making cannabinoids all the time. Anandamide, 2-AG, GPR55, and others that scientists are beginning to look at are compounds that function a lot like THC and CBD and the other cannabinoids in the plant. And when our bodies are working properly, we know how and when to make these to keep us in balance. So, how does cannabis work? There are 3 different types of cannabinoids. Now, there are over 100 cannabinoids in the plant itself, but there are 3 different types. There are endocannabinoids, anandamide, 2-AG, those that we make inside of our bodies endogenously. There are phytocannabinoids, THC, CBD, CBN, and others that are derived naturally in the cannabis plant. And then we have synthetic cannabinoids, or those that are produced by medical researchers in the laboratory, such as Marinol, which is a Schedule 3 synthetic THC and has been used since the late 80s and 90s with cancer patients and HIV patients. So much like if we have a vitamin deficiency, we would take a supplement. Dr. Ethan Russo began talking about something he calls clinical endocannabinoid deficiency. And he says that when this system of physiology gets out of balance, if we supplement with the cannabinoids from the plant, we can bring it back into balance or into a state of homeostasis, which explains how we reach that desired effect. Cannabis has been described as a pharmacy in a bud. The plant has cannabinoids and terpenoids, which are the aromas, like in essential oils, that have their own therapeutic properties, and how all the compounds in the plant come together and work synergistically is what we call the entourage effect. Aristotle said the whole is more than the sum of all of its parts, and this explains how cannabis works perfectly. A woman named Mara Gordon made a most excellent analogy a few years back, and I like to use it to explain how it works. She said we can think of it in terms of baking a cake. You have all the separate ingredients: flour, butter, sugar. You have the different flavorings: chocolate, lemon, vanilla. And whereas individually they may not be very good, we wouldn't sit down and eat a cup of flour or a stick of butter, but when we create the perfect conditions, mix them together, put them in the oven and bake it, what we come away with is really quite good. Now, as you can see in the chart, different cannabinoids act on specific symptoms or ailments. There are over 100 cannabinoids found in the plant, and this chart reflects some of the most well-studied. Along the top are the specific cannabinoids, and along the side, the ailment or the symptom that they can be helpful for. As you can see, there are multiple cannabinoids that act on the same symptom, maximizing that entourage effect. I'm only going to touch on 2 today because we don't really have a lot of time, and they're really the foundation of the products that we have here in Florida, although as our program evolves, I expect we'll see some of the minor cannabinoids coming into play. THC is the compound that is responsible for the euphoria, or what some people call the associated high. But what most people don't realize is that THC is a powerful analgesic, or a pain reliever. It can reduce nausea and vomiting. It can suppress muscle spasms. And of course, we've heard the munchie jokes. Certain strains or cultivars can stimulate appetite. CBD is also a powerful pain reliever. It has antibacterial properties. It can help regulate blood sugar levels, reduces nausea, vomiting, seizures, inflammation. We are seeing evidence that it can inhibit cell growth in cancer, suppresses muscle spasms, promotes bone growth, and it's a neuroprotectant. Now, CBD can also help to relieve anxiety, which is particularly helpful for cannabis-naive patients, because when CBD and THC are used together, the CBD actually helps to dampen down some of the psychoactive effects of the THC. The terpenes are the aromas that are present in the cannabis plant. Terpenes are also found in other plants and are the foundation behind the use of essential oils and aromatherapy. Has anyone in here ever used aromatherapy or essential oils for symptom control? So I know I love to use linalool, which is found in both the cannabis and lavender plant for its calming properties. Limonene, also found in lemons, can be uplifting and can also help to relieve anxiety. And pinene, also found in pine needles, can reduce inflammation. It acts as a bronchodilator, opening the airway passages, making breathing easier, and it can help aid in memory. An Italian researcher by the name of Vincenzo Di Marzo tells us that cannabinoids serve 5 essential functions. They help us eat, sleep, relax, protect, and forget, all of which are essential to increasing the quality of life. Cannabinoids have been shown to enhance fear extinction in humans, which can have great potential in the treatment of conditions such as post-traumatic stress disorder. And cannabis can also enhance adjunctive therapies commonly used in behavioral health, such as progressive relaxation, guided imagery, mindfulness, art, and music therapy, just to name a few. Areas of the brain affected by cannabinoids. Cannabinoids affect almost every area of the brain. The cerebral cortex plays a role in memory, thinking, and perception. The basal ganglia governs motor skills and learning. The hypothalamus, metabolic processes such as appetite. The cerebellum, coordination and muscle control. The amygdala helps to play a role in regulating emotions. The hippocampus is key to memory storage and recall. And the brainstem controls basic functions such as breathing. It's important to note that there are very few cannabinoid receptors in the brainstem, which explains why there's never been a recorded death due to overconsumption of cannabis in the history of all of history. Now, sadly, we know that's not the case with many prescription drugs. According to the World Health Organization, somebody dies of prescription drug overdose in the United States of America every 19 minutes. So I began to really research cannabis as a therapeutic option after my dad was diagnosed with stage 4 lung cancer. His treatment protocol included chemotherapy, surgery, and radiation. As a result of his radiation, he developed post-radiation pneumonitis and was diagnosed with chronic obstructive pulmonary disease. Now, patients with COPD can have a really hard time breathing, and this was made extra difficult for my dad because he had already had the upper right lobe of his lung removed. Following his radiation, we were told his condition was terminal, and I was prepared to put my dad on hospice care when, to my surprise, his radiation oncologist recommended yet another round of chemotherapy for a man who received a prognosis of less than 3 months to live. So that's when I stepped out of my role as daughter and into my role as social worker. To honor my dad's wishes, I moved my mom and dad from New York to Florida and into our home so I could be his full-time caregiver, and I enrolled him into the hospice that I was working at the time. So, along with a laundry list of opioids and other drugs, my dad was prescribed albuterol nebulizer treatments. Now, I'm not going to say that there's no use for pharmaceuticals, because I really believe that there is. But for my dad, I don't know what was worse, the COPD or the side effects of the albuterol. The side effects were really becoming intolerable for him. And that's when I recognized something. As a hospice medical social worker, I had seen that cluster of effects all too often. It looked a lot like what we call in hospice terminal agitation. So, terminal agitation is characterized by tremors, shakiness, nervousness, irritability, restlessness. Now let's flip to the next slide and take a look at what some of the side effects of albuterol are. According to the Mayo Clinic, the side effects of albuterol include tremors or shakiness, nervousness, headache, restlessness, irritability, muscle aches or pains, throat or nasal irritation, rapid heart rate, tachycardia, or feelings of fluttering or pounding heart. I began to wonder, why were we treating one condition at the end of life with a medication that was producing the very same symptoms that we as hospice care teams were struggling to provide comfort care for? I knew there had to be a better way. My research led me to the discovery of Tikkun Olam. Tikkun Olam operates under the Israeli Ministry of Health, and the researchers at Tikkun Olam wanted to study the effectiveness of cannabis therapeutics, so they conducted a research study. They had 2,041 participants in their study, and what they found was the number of patients taking no medication other than cannabis rose from 428 to 1,095. That means 667 of our elders were able to come off of all their other medications, some who were taking combinations of 7, 8, 9, even a dozen other drugs after a cannabis protocol was initiated. 1,950 of the 2,041 participants reported that cannabis helped their condition. 1,399 said it helped them tremendously. 95.5% said it helped them cope with their condition better, and less than 3% reported any side effects at all. My dad died 5 months before the first cannabis law was passed in Florida in 2014. The last few months of his life, he was readily prescribed albuterol, prednisone, hydrocodone, codeine, lorazepam, haloperidol, short-acting morphine tablets, long-acting morphine tablets, Roxanol, which is liquid morphine, and fentanyl, all of which can wreak havoc on a body. And he couldn't have access to a much safer and gentler alternative because it was against the law, and my 84-year-old Sicilian father was not about to become a criminal. So, after he died, the message that I carried forward to our lawmakers was, if this could be used for symptom control, shouldn't this? So the first picture is a picture of my dad getting his albuterol nebulizer treatment on Christmas Eve, 21 days before he died. And what you can see is that the medication's administered through the mouthpiece, but at the other end of this apparatus is an opening, and some of that albuterol vapor is actually escapes into the air. So what that means is that anyone who's helping to administer the medication to a patient, in this case, my teenage son, is also going to be subject to all the side effects on that Mayo Clinic slide that we saw. So the second picture came off of the Ticuno LOM site. It's a picture of a cannabis vaporizer treatment, and there are different types of vaporizers, handheld and desktop models. This is a desktop model. The vapor is collected in the plastic bag. The bag can be placed up to the patient's mouth. They can breathe in and inhale the benefits. Or for end-of-life patients who sometimes are in and out of consciousness, the bag can be placed up to their mouth or their nose, gently squeezed, and they can inhale the benefits without even necessarily having to disturb a patient. According to the National Council on Aging, approximately 92% of older adults have at least one chronic disease, and 77% have at least two. Heart disease, cancer, stroke, diabetes make up almost 2/3 of all deaths each year. 90% of Americans age 55 and older are at risk for hypertension, and women are more likely than men to develop high blood pressure. 1 in 4 older adults is likely to experience a mental health issue, and additionally, the number of older adults with conditions such as depression, anxiety, and dementia are expected to double to 15 million by the year 2030. Now, as a teenager growing up under Nancy Reagan's Just Say No to Drugs campaign, I learned that cannabis kills brain cells. So you can imagine my surprise when I discovered that cannabinoids actually act as antioxidants and neuroprotectants. Now, this can be evidenced by a patent that our federal government holds. Patent number 6630507 is entitled Cannabinoids as Antioxidants and Neuroprotectants. And I blew up a little section of the abstract so you could see it better, because it states, cannabinoids are found to have particular applications as neuroprotectants in limiting neurological damage following ischemic insults such as stroke and trauma, or in the treatment of neurological diseases such as Alzheimer's disease, Parkinson's disease, and HIV dementia. It's important to note that cannabis as medicine is not a new concept. Cannabis has been used by indigenous peoples for thousands of years. It was also included in the American Pharmacopoeia up until around the year 1937, when it was federally prohibited. At the federal level, cannabis is included in Schedule 1 of the Controlled Substances Act. This means it's in the same category as LSD, heroin, and ecstasy. Now, according to the DEA, the Drug Enforcement Agency, in order for a substance to be classified as Schedule 1, it must meet 3 criteria. Can have no currently accepted medical use, there has to be a high propensity for abuse, and it can't be used safely under medical supervision. Schedule 1 drugs are the most dangerous. According to current scheduling, cannabis is considered to be more dangerous than Vicodin, Demerol, codeine, Xanax, lorazepam, cocaine, morphine, and even fentanyl. Now, with 33 states plus the District of Columbia having passed some kind of a medical cannabis law, and knowing from my days as a substance abuse therapist that less than 10%, probably closer to 6 or 7% of all people who ever use cannabis go on to develop a compulsion, I say it doesn't meet the DEA's own criteria for inclusion in Schedule 1. And I'm not the only one. Arbitrary. Based on personal choice or random whim, rather than any reason or system. Capricious. Changing often and quickly, not logical or reasonable. Over the years, several petitions have been put forth to remove cannabis from Schedule 1. Back in 1988, Judge Francis Young presided over one such case. Judge Young concluded, "The evidence in this record clearly shows that marijuana has been accepted as capable of relieving the distress of great numbers of very ill people, and doing so with safety under medical supervision. It would be unreasonable, arbitrary, and capricious," Judge Francis Young went on to say, "for the DEA to continue to stand between those sufferers and the benefits of this substance in light of the evidence in this record." Judge Francis Young recommended that cannabis be removed from Schedule 1 of the Controlled Substances Act back in 1988, over 30 years ago. Now, unfortunately, the DEA did not comply with his ruling, and all subsequent requests, the most recent being at the end of 2017, have also been denied. So, we know what federal law says. I'm going to really breeze through Florida law and skip a whole bunch of stuff. But basically, Florida's first medical cannabis law, Senate Bill 1030, Compassionate Medical Cannabis Act, was passed in 2014. There were only 2 conditions that qualified and very few patients that took advantage of the program. Since its inception, the program has continued to evolve and expand. Amendment 2, the use of cannabis for debilitating medical conditions, passed with an overwhelming 71.3% vote of Florida voters. Now, what that did was it expanded the list of qualifying conditions. In 2017, Senate Bill 8A, which brought statutory law into alignment with the constitutional amendment, was passed. And basically, what Senate Bill 8A did was it had a very clear list of qualifying conditions: cancer, epilepsy, glaucoma, post-traumatic stress disorder, ALS, Crohn's disease, positive status for HIV and AIDS, multiple sclerosis, and Parkinson's disease. It also includes a clause that says, "or other debilitating conditions of the same kind or class as those enumerated, for which a physician believes the use of cannabis would outweigh the potential health risks for a patient." So on March 18th of this year, Governor DeSantis signed Senate Bill 182, an act relating to medical use of cannabis, into law. This makes access to smokable cannabis available to patients for the very first time. However, I think it's really important to understand the benefits to accessing the whole plant extends far beyond a patient's ability to smoke. Ground up cannabis can be infused into butter and different oils like coconut oil, which many people say have its own healing properties. These preparations can be used topically, sublingually, and can even be used in cooking to make homemade edibles, such as infused chocolates, brownies, cookies, and even comfort foods, such as mac and cheese and ice cream. Imagine the benefit to our most vulnerable of vulnerables. Imagine if, as they ate the foods that brought them comfort when they were well, their appetite was stimulated a little bit more with each bite they took. Imagine if the treatment left you feeling hungrier and happier instead of leaving you feeling nauseated or ill. What a beautiful benefit that would be. These are the stories that people are telling us. So edibles was passed under SB8A, but we don't currently have any commercially produced edibles. And the new smoking provision has left many patients frustrated because under Florida law, in order to access the whole plant, a patient has to go in and tell their doctor they want smoking added to their recommendation. Well, many of the patients don't really want to smoke it at all. They just want access to the whole plant so that it can be used in one of the ways that I already talked about. According to the Office of Medical Marijuana Use's most recent update, released on June 21st, there are currently 2,321 physicians in Florida registered as cannabis providers. There are 443,000 patients in the registry. 234,204 have active ID cards. On average, 4,500 to 5,000 new patient ID cards are approved each and every week. Clearly, this is an option that more and more Florida residents and seasonal residents want to try. There are 139 locations throughout the state where a patient or their caregiver can pick up the medicine. Those are listed on the slide. Many people today suffer from chronic diseases and struggle with issues like insomnia, anxiety, depression, and trauma. Cannabis can be tremendously effective for all of these and more. When a person is able to eat, sleep, relax, protect, and forget, this can make all the difference in the world. This, by the way, is Dr. Raphael Meshulam, who Holly talked about is the scientist or the father of cannabinoid medicine. Florida's program is ever evolving, and I plan to continue to advocate for safe and legal access and for the establishment of reasonable rules and regulations, not those that are arbitrary and capricious. We're on our way, and I believe that inspiring hope through excellence in education is the key to breaking through the stereotypes and busting open the stigmas that has kept this conversation shrouded in shame and guilt, because shame and guilt have no place in the healing process. So thank you for joining us today. And I hope you've heard something here that sparks an interest for you to learn a little bit more and maybe to step out of your comfort zone and contact your state legislator, your representative, your senator, and advocate for the expansion of this program. Thank you.